Hi everyone, welcome once again to my channel. I'm glad you're here today. If you're here today, you may be trying to understand if you're dealing with endometriosis or regular period pain, or you may be looking for an effective way for you to deal with the pain of endometriosis. Either ways, you're at the right place. So we're going to be teaching you certain things today to help you improve the quality of life, whether you're dealing with period pains or you're dealing with endometriosis. In this video, I'll take you on a journey to basically help you manage your symptoms and improve your quality of life through a holistic approach. And then we'll be discussing lifestyle modifications, nutritional support, herbs that are helpful in managing these conditions and relieving your pain, support, and just basically support your overall health. Okay? This information is important to help you diagnose early. You better improve health outcomes. You're able to manage symptoms, and best is that the stigma around endometriosis is removed. So it's not just people who have endometriosis that should listen to this or watch this video. Even workplaces, they should understand that not every period pain is just normal. In Nigeria, people can just come and tell you it's an ordinary period pain. No, dear, it's not ordinary period pain. And as usual, you all know that I like to give the information for free, right? If it is only to help remove the stigma, I've done something today. So, understanding endometriosis. Endometriosis is a condition where tissue similar to the lining inside your uterus grows outside of your uterus. This causes extreme pain, causes inflammation, and sometimes it causes fertility issues. Managing this condition involves addressing inflammation, hormonal balance, and even supporting your body's natural healing processes. And it's a bit tricky when it comes to distinguishing between irregular period pain and endometriosis. But here are some things that may make you dig deeper, at least some things to get you started. Number one is pain intensity and duration. In endometriosis, you experience way more severe period pain, and it goes for much, much longer. And then the location of the pain is the second thing that you want to look out for. The range is broader, and it may involve pain during urination, pain during bowel movements, and yeah, in cases of endometriosis. Number three, endometriosis often comes with heavy bleeding and even pain during intercourse. In some cases, fatigue and infertility. The diagnostic test is the gold standard, and that's laparoscopy for confirming endometriosis. And this is supplemented by imaging studies and also medical history. So if your parents had it, most likely you may be experiencing it. While the exact cause of endometriosis is not quite known, there's some theories and factors that may contribute to endometriosis based on research. Number one is retrograde menstruation. It's a very interesting phenomenon, where menstruation flows backward and then the endometrial cells implant themselves on the outside of the uterus and then they begin to grow. This, however, doesn't happen all the time. Other causes may include surgeries like hysterectomy, hormonal imbalances, especially estrogen dominance, and also environmental toxins. You guys know that this is always my favorite part all the time. Lifestyle modification. What can you do to help you manage endometriosis better? Always at the top of my list dietary changes. Dietary changes. An anti-inflammatory diet is very important. Eating an anti-inflammatory diet can help you significantly reduce the symptoms of endometriosis. You just focus on consuming a variety of fresh fruits and vegetables, especially leafy greens, berries, and cruciferous vegetables like broccoli, cauliflower. Incorporate whole grains into your diet. You're looking for lean proteins like fish, healthy fats from sources like avocado, nuts, and seeds. You want to avoid some trigger foods, right? And it's beneficial to avoid foods that can trigger inflammation, right? And hormonal imbalance. And these kind of foods includes reducing your intake of red meat, for example, because red meat potentially has estrogen in it, also, contributing to estrogen dominance. Processed foods, dairy, caffeine, alcohol, these are things that you want to avoid. Some women find relief in reducing gluten and soy as well. Another thing you want to do is to stay hydrated. Staying hydrated is very, very important if you have endometriosis or even if you experience period pain. Aim to drink at least 8 glasses of water a day. Herbal teas like ginger, chamomile can also be really soothing for endometriosis. Apart from your diet, as usual, exercise comes next. Regular physical activities can help reduce inflammation, manage weight, and improve overall health. Aim for about 30 minutes of moderate exercise like brisk walking, swimming, yoga, most days of the week. Yoga and Pilates can be particularly helpful because they improve flexibility and they reduce stress. And this brings me to the next point, right? Stress management. Stress can do a lot to exacerbate endometriosis symptoms. So managing stress is very crucial. Practices like mindfulness, meditation, deep breathing exercises, progressive muscle relaxation can be very effective. So consider incorporating these into your daily routines, even if it is just 10 to 15 minutes every day, right? I've been saying 150 minutes, right? But even if it's just 10 minutes every day, it would go a long way to help. Next on my list is sleep hygiene. Adequate rest is vital for healing endometriosis and even overall health. 7 to 9 hours of quality sleep, super important. Establish a consistent sleep schedule. Create a relaxing bedtime routine. Ensure your sleeping environment is comfortable and is conducive to sleep. And then if you're looking to use herbs and supplements, turmeric is a very powerful anti-inflammatory herb. The curcumin, which is the active ingredient, can help reduce inflammation and pain. So you can incorporate that into your diet, or you can take it as a supplement. So you can also aim, if you want to take it as a supplement, aim to get a standardized extract containing about 95% curcuminoids, and then consider pairing it with black pepper to enhance absorption. Second on my herb list is ginger. Ginger has anti-inflammatory and pain-relieving properties. You can decide to use fresh ginger in your cooking, drink ginger tea, or you can take ginger supplements. And it's really, really helpful to help relieve endometriosis pain or even period pain. And then omega-3 fatty acids. You can find those in fish oil, in flaxseed oil. They have anti-inflammatory effects also, and they can help reduce pain associated with endometriosis. So aim for high quality fish oil supplements also. That's if you want to go for supplements. Ensure that they have a balanced ratio of EPA and DHA, or you can incorporate fatty fish like salmon into your diet. But here in Nigeria, I think you can look out for Titus right? It's a fatty fish and it's also pretty helpful. Fourth on my list is evening primrose oil. That one is rich in guanylinic acid, which helps reduce inflammation, improves hormonal balance, and it's often used to alleviate menstrual pain and support reproductive health.